Hello everyone. Today's discussion is on sciatica and its management from the angle of alternative medicine. Earlier in my videos, I described the management of low backache by acupressure. Backache, as we know, may or may not be associated with sciatica. So, what is sciatica? Sciatica refers to pain that travels along the path of the sciatic nerve. The sciatic nerve, as we know, travels from the lower back through the hips and buttocks and down each leg. The sciatic nerve is formed from the nerve roots of the lumbar fourth and fifth and sacral first, second and third. These nerve roots join together and form a single nerve, the sciatic nerve, which is the longest nerve in the body. Just above the knee, the nerve gives off branches to various areas of the lower limb, and pain could be experienced in all or different areas depending on the nerve root dermatome's distribution. The dermatome distribution of the roots of lumbar 4 to sacral 3 are depicted in the accompanying diagram. Pain or sensory loss over the distributions of the dermatomes of the lumbar 4 to sacral 3 may thus be pointing towards the involvement of the sciatic nerve. When there is no response by the traditional methods of treatment, alternative medicine can be tried. Promising results are seen when a combination of yogic techniques, traditional Chinese medicine, and Sujok therapy are used in a combination. Yogic techniques include several stretches that may alleviate the low back's nerve compression. The first asana to be discussed is Vajrasana. During Vajrasana, the heels automatically compress the gallbladder 30 acupuncture point by the heels, and therefore this asana is extremely helpful for those suffering from sciatica. The next asana is Shashank asana or child's pose, which is an excellent yoga pose for relieving sciatic nerve pain because it helps you to stretch your spine while also opening up your hips. Stretching and relaxing these muscles can help to relieve excessive tension in the lower back. The next asana to be discussed is Pavan Muktasana. This pose helps to relieve tightness in your lower back, hips and glutes. To feel the pose less intensely, one leg at a time can also be done. Bhujangasana is also a highly recommended yoga pose for sciatic nerve pain as it keeps your back healthy and strong. It tones the back muscles, adjusts small adjustments and displacements in the vertebra, and keeps the posture correct. Shalabhasana stabilizes the lower back and core muscles. Notice that the hands are kept under the thighs with the palms facing downwards. During the asanas, indirect compression of the concerned acupressure points for the spine on the palms and soles take place. During Shalabhasana, pressure is exerted at the level of the wrist and outer aspects of the thumb to stimulate the sciatic nerve and the spinal column. Whether sciatica originates from your low back or the piriform muscle in the buttock, Setubandh Asana should help. It strengthens the low back and supporting musculature while simultaneously opening up the hip flexors. The back muscles, the glutes, and hamstrings get toned up. During Hastpadottanasana, the core muscles are strengthened and the body is resting over the sacral bone. One can now visualize how in this particular asana, certain acupressure points over the sacrum are getting indirectly compressed to augment the benefits of this asana. Acupressure on these points for at least 1 minute has been advocated to help patients. Ushtrasana also stretches the lower back and helps in sciatica relief. The meeting of the palms and soles and subsequently remaining in this position helps to stimulate acupressure points on the palms and soles. Notice how the palms and soles meet. The palms and soles meet and stimulate the areas of the spinal column. Marjari Asana helps to increase the flexibility of the spine, and exercising by opposite hand and leg raising or the bird dog position helps to stabilize the sciatic nerve. In addition to these yogic exercises, practicing Ujjayi breathing and full yogic breathing can help calm the nervous system, enabling you to cope up with the sciatic pain. Clinical studies on the efficacy of acupuncture therapy and acupressure in sciatica are increasing. According to the traditional Chinese medicine, sciatica belongs to the gallbladder meridian and the urinary bladder meridian. Now GB34 and GB30 points are the two acupuncture points for treating sciatica. During electroacupuncture, the GB30 is connected to the positive electrode while GB34 is connected to the negative electrode. A dense dispersed wave with a slow frequency setting at 2 Hz intensity is generally used, and according to the patient's comfort, this threshold is adequate. Treatment time is usually 30 minutes. During acupressure, GB30 can be effectively compressed with the bent elbow of the therapist with the patient in Shitilasana or lateral position, or the thumb while in standing position. GB34 can be effectively be compressed with the help of the middle finger. Application of pressure at these points can be done for 2 to 3 minutes, 4 to 5 times in a day. The following additional acupuncture points are also recommended depending on the area of involvement of the sciatic nerve. The following illustration gives an idea of these additional points. For acupressure, usually each point is compressed for 1 minute, 4 times in a day, and in acute situations, this therapy can be done for 5 to 7 days. Sujok therapy from Korea is a healing methodology based on acupressure and is a simple method that produces highly effective results. In Sujok therapy, The palms and feet represent all the active points in the body. This illustration depicts the location of the various parts of the skeleton on the palms and soles. The third and fourth fingers and third and fourth toes represent the lower limbs. A combination of the right foot and left hand or the left foot and right hand are used for therapy. Pressure is applied along the yellow lines for right-sided sciatica and along the red line for left-sided sciatica. Application of pressure can be done by a smooth or rounded object such as a pen or wooden device as depicted. For right-sided sciatica, initially gentle massage along the yellow line is given 3 times. And then intermittently pressing and releasing all along the line, pressure is given 3 times. Similarly, massage and intermittent pressure are given on the right foot along the line for right-sided sciatica. The starting point is where the heads of the third and fourth metatarsal bones join. A 20-minute session of alternative medicine could be the answer to your sciatic problem. Commence with the following yogasanas in a sequential order, starting with Vajrasana, Shashankasana, Pavanmuktasana, Bhujangasana, Shalabhasana, Setubandhasana, Hastpadottanasana, Ushtrasana, and lastly Marjari Asana and its variation. Spend at least 1 minute each in each of the yogasanas and 1 minute each for yogic breathing and Ujjayi breathing. Then apply pressure on acupressure point GB30 followed by GB34. The massage at these 2 points should be for 2 minutes each. Lastly, perform the Sujok therapy. Spend a minute each over the dorsums of the palms and feet as described earlier.